Hello everyone and welcome to another session of next Saviours Essential Question Series NEET PG 2025. Today we are going to have a discussion on one question from our app which is essential for you for your NEET PG examination. Remember, no one should be taking credit for your success. You yourself have to structure your own future and your success. And for that, you need a correct direction, and that correct direction is provided in the form of essential questions which will build up your confidence, which will help you out in cracking these examinations. So, more than 2000 questions are provided and are live in our Next Saviors app. So, let's start with the question that a 10-year-old boy presents with the complaint of fatigue and abdominal pain after playing football. Now, it makes no sense, obviously, at this point. But when you see on detailed history, he also has complained of painful swelling of digits in the past. And on USG abdomen, he was found to have a smaller spleen. What is the most likely diagnosis with the four options provided to you in the question? So, whatever the answer you have marked, when you will come to the explanation, this is how the explanation will look like. That, dear saviors, the key features from the case that suggest sickle cell anemia are the fatigue and abdominal pain. Now, what are the reasons for that? That these symptoms are common in SCA, especially due to complications like splenic sequestration or acute pain crisis. The abdominal pain could be related to vaso-occlusive crisis, which is affecting the organs. Now, why there is a painful swelling of the digits? This is a classic sign of dactylitis, which is painful swelling of the fingers and or toes, which are often seen in young children with sickle cell disease. It results from the blockage of small vessels in the hand and feet, which is causing pain and swelling. So that was provided to you in the question. The third one is autosplenectomy, that is splenic atrophy. Why? Because children with sickle cell anemia often experience splenic infarction due to sickled red blood cells blocking the blood vessels in the spleen. So over a period of time, this leads to splenic atrophy, which results in a small spleen on imaging, a characteristic finding in SCA, particularly in young individuals and adolescents. In continuing with the explanation, it is also provided that a quick revision note on sickle cell anemia that you should be able to remember or you should be remembering. One is obviously the definition. It is a hereditary hemoglobinopathy which is caused by a point mutation in beta globin gene, right, leading to the formation of hemoglobin S. Genetics and inheritance which are involved. It is autosomal recessive. The mutation is in beta 6 glutamic acid conversion to valine, which is because of the missense mutation. And HBS polymerizes under hypoxia, acidosis, or dehydration, which is responsible for causing sickling of the cells. So, what is the pathophysiology? It is all provided to you in the explanation. Like sickled RBCs leads to rigid, sticky vaso-occlusion and hemolysis. So chronic hemolytic anemia along with the ischemic injury to the multiple organs. So sickle cell anemia is a genetic disorder which is caused by a mutation of H hemoglobin gene leading to the production of abnormal hemoglobin, that is HbS. Under low oxygen condition, the RBCs containing HbS, this sickle, that means they become crescent shaped, and which leads to blockage of the blood flow, hemolysis, and various complications like pain, crisis, and splenic dysfunction. Now, what also is provided to you in the explanation are the important systemic features related to sickle cell disease. One is obviously the hematologic, which is chromic anemia and reticulocytosis. The vascular occlusion will result in painful vaso-occlusive crisis. Respiratory functions are manifested as acute chest pain syndromes characterized by fever, chest pain, and hypoxia. In CNS, there could be a possibility of a stroke, especially in case of children, or there could be a seizure related to hypoxia. In gastrointestinal system, there will be a splenic infarction leading to autosplenectomy and even gallstones. In genitourinary system, there could be a hematuria or priapism. Skeletal, there will be avascular necrosis of the head of the femur. There could be osteomyelitis, which is related to the salmonella, because salmonella is the most common organism causing osteomyelitis in a patient who is suffering from sickle cell disease. And it might also predispose the individuals for certain infections by the encapsulated organism like Streptococcus pneumoniae, Haemophilus influenzae, Neisseria meningitis due to functional asplenia. So once we have done with the clinical features, then in the explanation itself for your revision, there is a provision of what are the tests which are required for making the diagnosis. On the CBC, there will be normocytic anemia, increase in the reticulocyte count. Peripheral smear will show sickle cells and the target cells. How they looks like, we'll talk about it in the next slide. The HB electrophoresis, there will be increased concentration of the HBS, absent HBA in homozygotes. The sickling test is positive with sodium metabisulfite, and in newborn screening, it is mandatory in endemic areas in particular. So these are the laboratory findings which are usually kept in your examinations. Now, as far as the management or the treatment is concerned, it is also provided to you in the explanation. Like for the symptomatic management, pain has to be controlled using NSAIDs or the opioids, hydration and the oxygen. The disease modifying drugs are hydroxyurea, which is responsible for increasing the HbF concentration and reducing the crisis. What are the preventive methods? Folic acid supplementation, the vaccination to prevent the infections from pneumococci, Haemophilus influenzae, and meningococcal infections, and along with the prophylactic penicillin in case of children. For curative, there has to be a bone marrow transplant in severe cases. Acute crisis is managed by blood transfusion, exchange transfusions, and these are manifested as a stroke or acute chest syndrome. So this is the management which is provided to you in the explanation for your further learning related to that particular question. Now, peripheral smears, the very specific finding obviously is the sickle shaped RBCs, which can be immediately identified by any student. Apart from this are the target cells, and how these target cells actually appear. These are abnormally shaped red blood cells with the darker central area and a dark outer ring. And this is the reason why it appears like a bull's eye, and the reason why it is called by the name of target sign. Now, what are the other condition in which this target sign is seen? In case of thalassemia, in case of asplenia, that means post splenectomy, and in case of liver dysfunctions. So these are the other conditions where you see bull's eye. And finally, another specific finding are the Howell Jolly bodies. Now, what are these? These are the basophilic nuclear remnants which are seen inside the RBCs on the peripheral blood smear, and they usually appear like a single round dark purple inclusions. So, why do they appear? You see, they are normally removed by the spleen. So, their presence is suggestive of either asplenia or hyposplenism, that is, post splenectomy. Apart from this, in case of functional splenic atrophy, like in case of sickle cell disease, and severe hemolytic anemia or megaloblastic anemia. So these Howell Jolly bodies are seen in this condition. Finally, in the table, you are also provided in the explanation about the MCQ clues. Like if there is a colored child along with dactylitis, then think of sickle cell anemia as an early manifestation. Now, the child with recurrent salmonella osteomyelitis, this thing has been asked multiple of the time. Then again, think of sickle cell disease. What is the best test for the diagnosis? It is HB electrophoresis. What is the first line of drug to reduce the crisis? It is hydroxyurea. What is a curative therapy? It is the hematopoietic stem cell transplantation. So this is how the question is getting concluded. We thank you for listening. All the best for your future examinations. Prepare yourself well for all the upcoming examination. You'll see this Next Saviors app, which is live on Android as well as on iOS, is best, and this essential question series in particular is best suited for the MBBS final year students, because they will come to know how exactly the questions are getting asked, and for the interns who are going to appear the next year, so that you don't become blank when you really are sitting in front of your computer screens. All the best. Thank you so very much.